Pam is an active woman in Tampa, Florida, who enjoys day traveling and walking with her husband.
I'm a homemaker, and it's what I do. We're retired. And for fun, we'll go out to eat. We'll go, take a day trip.
Pam's pain started years ago and has only worsened over time.
The pain started, many years ago, and I had scoliosis, and it gradually got worse. And over time, and in the past 2 to 3 years, it got really bad. And I started having more aches and pains in other areas of my body. When I had the pain, it was on usually always my right side. I would say more my hip area, and that's where I'd have to stretch because the muscles would spasm. And from spasming, your body tightens up and you can't walk. We would try to walk, and I would say, we've got to stop. And I'd have to do some stretches because of the pain, mainly my right side. And in doing those stretches, it helped, just a few minutes. And then I said, we've got to walk back home. Finally, he would say something about going for a walk, and I'd just end up saying, you go, and I'll stay home. I ended up doing a lot of sitting. Got to where I think it made it worse because I wasn't moving around. It's such a job just to get to walk from one room to another. It's exhausting. It was exhausting. I was struggling to walk in. I got to the point I was needing a wheelchair. If I was going to walk a long distance, I didn't want to be dependent. And I was just, in the past few months, started using a wheelchair on some cases, like going to the airport. So I really was getting where I could not do anything.
Pam used over-the-counter medication to try and relieve her pain, but soon realized she was going to require something more to help her regain her ability to walk.
The Tylenol thing, like most people, some kind of a painkiller. I was so tired of calling doctors and going to doctors and getting, this medication or that medication. Toward the end, I did do some physical therapy. It was due to a pain that I was having in my foot is the reason I got started there. Whatever I tried, nothing helped.
Pam's husband saw a commercial for the Bonati Spine Institute while watching TV and suggested that it was something they should look into.
He saw one of the commercials. And so then we got online and we started doing our own research from there. I really appreciate all of these videos that you do, because it explains things. And I've told friends about Dr. Bonati and his procedure and what others had said.
After a preliminary physical exam, Pam was sent to the on-campus imaging center for a series of x-rays. A short while later, she met with the surgeon to review her MRIs and fresh x-rays to determine a customized surgical plan to eliminate her pain.
I was excited about coming for consultation to hear more about what my back looks like, what they see in my spine. When I came here, I did have an x-ray taken here at the Bonati Institute. And the gentleman who helped me with the process, very polite. And I will say that about everybody here. It's very polite. And then Dr. Bonati came in, and I said, I am so glad to see you. And he said the same thing back to me, and then he pat me on the arm, and I thought, that's neat, because he really has spoken to me through the videos, and then to meet him in person touched me.
The exclusive Bonati Spine procedures are performed incrementally using conscious IV sedation, where the patient remains awake and communicating with their surgeon to determine the source of their pain and eliminate it before they leave the operating table.
I liked having not being put out for surgery. I like being able to be aware. They do ask questions. Did we take care of everything? How are you feeling? I really like the idea of being able to communicate with my doctor. So I was able to have my husband in the surgery with me. My husband loved it. He thought it was interesting. There was a monitor. He could watch the monitor, and he could see the exact same thing Dr. Bonati was doing. When I had my last procedure, they said that this would help go down my leg, and where I had pain as well. And I tell you, last night I realized I don't have that pain anymore. It was gone. the pain is gone in my right foot.
No pain there?
No pain there.
No pain here?
No pain.
No pain on the butt?
No.
No pain on the back?
No.
After surgery at the Bonati Spine Institute, patients are asked to take a brief walk in the recovery room before returning home or to a nearby hotel to continue their walking regimen.
The nurse, she was right there with me as we walked up and down the recovery room. I haven't been in the hospital. It's all done here at the Institute. And it was nice being able to say that. Stayed in a motel that's only 5 minutes away. And that really, that helped tremendously. I have no brace at all. What they asked me to do after surgery is get up and walk every day. That's a gift of life, really. My original pain, of why I came here, that's gone. What I'm feeling is the effects of surgery. And I'm very thankful that I came here. I really am. I would most definitely recommend Bonati Spine Institute to everyone. And I have people watching me now because I've come, and every day I get home, they said, "How did things go for you today?" They want to know, and some of them have had back surgeries. They're watching me, and they're coming to me every time I see them, and I'm talking right now mainly people at church.
Now pain-free, Pam is looking forward to spending quality time with her husband again.
To go shopping together. We enjoy, Costco's one of our favorite places, so we'll go there together and walk up and down those aisles.